Our next speaker is Dr. Steve Eubanks. He's now at Florida Hospital in Orlando, and I think we've asked him to speak because of his overwhelming success as an innovator. So, Dr. Eubanks, thank you.
Dr. Horvath, Dr. Pryor, thank you for the opportunity to participate in this conference, and good morning to all of you. So I have a little bit of a tougher talk. This one's not as cut and dried as some of the prior conversations, and a lot of this is personal advice as opposed to good statistics to talk about how we best interact with industry. And so this one's been titled Partnering with Industry, the Good, the Bad, the Ugly. We have to start with disclosures, and you see multiple disclosures there, some consultant royalties, founder of a company that will go away within the next year, then some laboratory and course support, others with scientific advisory board, speaker, course director, and then a recent one with other product development. Dr. Tom Fogarty is one of the great inventors of our time, and at a national meeting a couple of years ago, Dr. Fogarty stood up and said, if you don't have anything to disclose, it means you're not doing, and you can choose the adjective of your choice in that arena. Now, Dr. Fogarty was primarily talking about innovation and product development, and that basically if you're not working with industry, you're probably not developing any product that's going to reach the marketplace. He was not specifically talking about research, because as you've seen from the prior talks, there are many pathways to get funding for research that do not require industry collaboration. But it is something that should be considered when you're looking at those different sources. And again, we're going to talk not only in terms of research, but also development of other concepts about how you should interact with industry as you do that. If any of you are sitting there and saying, not me, I'm pure, clean, holy, and I have nothing to do with industry support, get up and leave now, because you're actually sitting in this chair at the price you paid because industry supported this meeting. If you ever attended a grand rounds, industry probably supported that. Certainly if you've ever picked up a sandwich or anything at your hospital where industry brought that in, you have been industry supported. So you may not have disclosed it, but if you've been educated in the modern era of surgery and have done anything except stay secluded in your home, you've been involved with industry to some degree or another. So another disclosure, I'm not an attorney. Thank God I am not an attorney. I would not get out of bed in the morning. But some of the topics I have to cover this morning do discuss some legal matters, and I can only discuss those as a surgeon to surgeon. I don't have any expertise in the law, fortunately, either as being convicted of anything or from legal training. So I'm going to talk to you as a peer, not as an attorney giving you legal advice. So this says Friends Romans Corporate Sponsors. We are not to the point where we have to wear the logos of our industry supporters on our lab coats as we walk the hallways. We don't have to declare on all of our t-shirts, hats, and everything else who actually is helping us through that operation or through that clinic that day. But we're not that far from it in all reality. And if you actually look at the budget of any national organization, whether it is this, whether it's the American Surgical, whether it's the American College of Surgeons, and you see what percentage of that annual budget comes from industry, we probably should wear some logos, because we are heavily dependent upon industry for our education, for our conferences. It's how we manage it is the key. It's not that whether we should or should not do this. So partnering with industry, the good. First of all, relationships. I'm going to start with that. In the back of the room, my friend Glenn Warren is here this morning. 1993, I arrived at Duke. Glenn was my local U.S. surgical rep. We not only worked 12 to 16 courses together each year, daily in the operating rooms, but we developed a fast friendship. Our kids grew up together. Our oldest have graduated from college. They're close friends. We've vacationed together, we've traveled together, we own property together. We've had a dynamic, wonderful friendship for more than 2 decades. I have many friends in industry who are actually closer than most of my friends in medicine. This has made my career, my life, much, much richer. It's not always that end product of the paper or the product that you develop, but many times it's the journey that you take, and it's those people with whom you travel on that journey. And there's some wonderful people in industry who I would encourage you to form those friendships and those relationships with that will make your career much richer. Secondly, resources. Most of the large companies have far more resources than your home department, your school, or if your school has it, they won't relinquish them. But there are a lot of resources there to accomplish things that you cannot accomplish without those. Almost none of us will have access out of our own checkbook, our own pockets, to be able to take a product concept from concept to the marketplace. We just don't have that extra 75, 100, 150 million dollars lying around to get from concept to the marketplace. Industry does, and they allocate that for product development. Expertise. Maybe one or two of you in here have extensive training in engineering or biomedical engineering, like Dr. Pryor, and you have some expertise that industry has. But even if you do, even if you have an undergraduate degree in engineering and a master's in material sciences, you know what? You don't have expertise in regulatory matters. You're not an MBA. You haven't managed hundreds of millions of dollars in budget. You've never taken the products from concept to marketplace. You don't understand market strategy or how to do a market landscape. Companies have all of these people who not only have done it, they do it all day, every day. So you can partner with people who have great expertise in things you don't have. Exposure. You are exposed to a world in which we don't work. We go into this thing of medical school residency and our early practice, and we are lost from the rest of the world. I went through for years where I didn't see television. I didn't know who won which sporting events. I didn't know what was going on there because I was completely within a world of medicine. Suddenly now you're looking at people who look at the world differently, who have lived in a different arena, and you're exposed to that. They also provide exposure for you, your concepts and your ideas, and can get exposure that can advance your career or can advance whatever you're trying to do, whether it's a publication or a product, to where others begin to know about it. And then respect. Respect has a lot of different facets, but one of which is very quickly, if you actually partner with industry, you find that there are people within industry for whom you will have great respect, both with what they've accomplished in their career, what they know, how they go about carrying themselves. And if you carry yourself properly, you will also learn that you can quickly become respected by industry, not because of the letters after your name, but because of what you bring to the table and what you can contribute that perhaps within their expertise they don't have. The bad, perception of being dirty. Most of the people at this arena within their own institutions certainly will have partners, a chair, others who will look at you a little bit dirty if your money for your research project came from industry as opposed to coming from the NIH or coming from a national society. You can be perceived as being second tier. You just weren't quite good enough to go ahead and get that. I lived through some of that myself in my early academic career. I remember I signed a deal for $5.2 million for a grant from industry. I went to my chairman. He, of course, was ecstatic that we had that money coming in. And I said, well, now that we have this and I'll have great funding, is it possible for me to get a resident? He said, oh, no. We don't put residents in labs that are funded by industry. Your lab has to be NIH funded before you can have a resident work in your laboratory. So that was the game. I learned the game, went on, developed a basic science lab, and we did get NIH funding so that we could have residents work with us. But that dollar was not seen as the same dollar coming from a national source. There's an ongoing decrease in available support. Doesn't mean that the companies don't have the money, but the money that is open and free to be able to support what we do is rapidly shrinking. The process to obtain that money is becoming more and more like government funding agencies. The compliance rules are becoming more stringent, and so it's not as easy. In my first 9 years in academics, I brought in $23 million plus from industry money. I probably will not accomplish that in the remainder of my career because the money simply is not as available as it once was. There's also increased competition for funds. The NIH has become more competitive. SAGES, when we first started doing research grants, there weren't that many submissions. Now there are a lot of submissions for those 6 or more or less grants, and it's very tough to get your hands on money. The other thing is that the rules of engagement are ever changing, and you have to be aware of this. If right now, for most of you who are young in your career, I talked about how we did things 15 years ago, you would probably be appalled thinking how filthy and dirty these guys were. This is terrible. But at that same time, you would sit in a restaurant and people were smoking all around you. And today you would be appalled if you went into the restaurant and people lit up right beside you, because culturally we have changed. Our engagement with industry has changed dramatically. It was not a bad thing 15 years ago to fly to the Bahamas and do a 2-day conference with a company, a quality conference, but do some scuba diving, play at the beaches, ride around on mopeds, and they picked up the cost for you and your family. Today, you can't do that anymore. It doesn't mean we were doing dirty things. We were doing things that were within the acceptable standards at that time. What we do today may be considered appalling 5 or 10 years from now. So this world does continue to evolve. There also are frequent changes in industry partners. Yesterday, Glenn and I actually ran into a guy from Covidian. He's probably the only guy left that I know within that very large company. And at one time, I think I knew hundreds of people within that company. I've probably been through 6 or 7 different presidents I've worked with that company over my career. At Ethicon, it's a revolving door. I have to sort of almost keep an ongoing updated Rolodex because the people in positions keep changing. The point being that you're going to form a relationship, someone's going to believe in you, they're going to want to fund you or your program, and then you turn around 6 months later, they're wearing a different hat working for a different company, or they've been promoted and now they're doing global and not domestic. So it's an ongoing process to continue to develop those relationships with a particular company so that they will continue to want to fund your efforts. The ugly. And there is some ugly. There are some very, very unethical industry employees. I had one come to me recently and say that their boss said, all doctors can be bought. You just have to find out what they want, get in their pocket, give them what they want, then you own them, and they will have to get your product into the hospital. That's the approach they're taking for sales. Likewise, unethical physicians. I had an industry partner come to me recently and say, we met with a very, very well-known surgeon who said, if you will give me enough money for this research project, I will give you whatever results from it you want. On both sides, there's some dirty people. But here's the risk. You do this wrong, you're going to lose your job. If I'm your boss and I catch you doing that, you won't be with us anymore. You do this wrong, you're going to lose your reputation. It's going to be hard to get funding from anywhere. And do this really wrong, and you're going to end up in jail because there are actually federal laws that prohibit the type of kickback and the inducements that can take place. And not only will you no longer practice medicine, you won't have the freedom to walk around. How is this managed? Institutional oversight. Whatever you're doing, you must disclose. Disclose within your own institution, disclose when you're giving talks. Usually there are different agencies, and this does not encompass all, but there are CME offices, there are departmental offices, there's an IRB, an ORA. Any purchase decision that takes place within your institution, you must disclose if you have any financial conflict or your family has financial conflict, and recuse yourself. Step out of that. Do not have a voice at the table. Do not manipulate the process behind the scenes. Get out of it. That's where you're going to get in really big trouble, because as soon as you have manipulated the system to get products in and they are used on a Medicare or Medicaid patient, you've just invited the IRS to come in and take a look at your taxes. You've just invited governmental agencies to come in and take a look at what you're doing, and you get yourself and your institution in big trouble. External oversight. This falls under the jurisdiction of the Department of Health and Human Services through the Office of Inspector General, and there are federal anti-kickback statutes, and they base upon something that is called unlawful inducement. And that means I give you something you want, you need, and therefore you do something I want you to do. I want you to use my products, I want you to refer patients to a certain nursing home, but I'm slipping you something that you like, cash or something of value, so that you will do something you would not otherwise do. That's an unlawful inducement, which can carry with it very hefty fines and even prison sentences. The Stark Law is something you will hear about. Stark Law was called the Ethics and Patient Referral Act of 1989. It really had to do with not taking patients and referring their work to clinical laboratories where you have a financial interest or your family has an interest. Like many laws, it has expanded, and you will hear your own institution talk about, I can't give you these tickets to the basketball game that our hospital has the tickets because that would violate Stark laws. You'll hear about compensation issues that are about Stark laws. So there are many, many iterations. There are state laws. You will see signs in the exhibit hall sometimes that says, welcome to have a cup of coffee unless you're from the state of Massachusetts. The state of Massachusetts has very rigorous laws about what you can and cannot do relative to industry. So within your own state, there's certain iterations. And then there's something called Advameg. And most of how we practice with industry today is guided by Advameg. They're a medical device trade association. They advocate for legal, regulatory, and economic climate that advances global health. And they have a code of ethics, easy to look up on the internet. This facilitates ethical interactions between the medtech companies and healthcare professionals to make sure that the decisions are in the best interest of the patient. So quickly, what's allowed? You can be a consultant, you can be on an advisory board, you can have royalties, meals, even if scientific or educational business is presented, educational and patient benefits up to $100, textbooks or anatomical models, even if they're more than $100. Not allowed entertainment, recreation, theater tickets, sporting events, golf, skiing, sporting equipment, vacations. Can't even have gifts, pads, note pens that have the name of industry on them anymore. Even in your career, that already has changed where we're not supposed to get those anymore. So in summary, partnering with industry can require traversing very tricky and dangerous waters, but it's a journey that is well worth the risk. Thank you for your attention.